from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back to this Wellness Wednesday. The time now is 6:23. The last time Baptist Health cardiologist Dr. Anthony Fletcher joined us, we talked about cardiac arrest and the importance of early CPR. Well, back in the studio this morning to do just that is Dr. Fletcher, along with some help from Matthew Stripling from the American Heart Association. Thank you both so much for being here this morning. This is important information that we all need to hear, and we've heard it maybe before, but it's something that we need to hear again and again. Let's talk about CPR first, exactly what it is.
Absolutely. Good morning. CPR is a technique that was developed back in 1968 that allows us to maintain circulation in someone who's had an arrest. They're pulseless, they don't have a spontaneous blood pressure, and they're not awake. And CPR is just a combination of events. It's head tilting, it's maintaining circulation through compression of the chest, and then also there's artificial breathing for respirations. And this technique came about 1968, and the first mannequin came about 1989. So this is kind of a technique that's been around for a little while, but certainly something that's very important.
Who exactly, or when should CPR be performed? Because sometimes you think, oh, I see someone that looks like they're passed out. Do I need to do CPR?
Absolutely. Well, number one, you want to make sure, are they breathing? And then you can feel for a pulse. Do you feel a pulse? Are they alert and responsive? And if not, then you should yell for help. And look and see if there's an AED somewhere in the vicinity. Have someone call 911 if someone else is available, and then immediately start CPR. And that's important because the brain and the heart need blood circulation, and the longer you wait to do that, the greater potential we have for poor outcomes.
And I know Matthew's going to talk a little bit about the technique because we see it on TV, Matthew. We hear about it. We think we all just know how to do that, but there is specific things that you need to
Absolutely.
know.
And we all probably traditionally know regular CPR with the rescue breaths and all that kind of stuff. But today, we want to talk about hands-only CPR because we want more people doing CPR than in the past. We know that about 350,000 cardiac arrests happen outside the hospital each year, and only 10% survive that. So what we want to do is get CPR started early, like we talked about, and soon. So what you want to do, if you come across someone, maybe you're out at the river trail or something's going on, and you see someone's unconscious, like we said, call for help, call 911, and then you want to start hands-only CPR. So basically, you want to find the mid part of the chest, and both hands want to be across the sternum, and you want to push hard and push fast. And what you're doing here is you're looking for a 2-inch compression so that we keep that oxygen going through the vital organs, the brain, the heart, all of that stuff. So the more circulation we can keep going, the better off.
And you keep doing that till help arrives?
You keep doing it till help arrives, or someone who is trained in traditional CPR comes along, or till EMS or someone from emergency response arrives.
And you guys at the American Heart Association have opportunities for everyone to learn how to do CPR.
Yes, ma'am. We work with CPR in schools where high school seniors get trained every year. There's plenty of classes that we taught. All kind of opportunities out there.
Yeah, easy to do, easy to find out about, and you prefer that before they get to you, Dr. Fletcher, there has been someone performing CPR.
Absolutely, and the sooner we start CPR, the better chance we have for a successful outcome. And also CPR can be learned at Baptist Health. Call the 1-800 number, and also the Red Cross. And there are venues on YouTube and various social media mechanisms by which you can also learn CPR.
No excuses not to learn. There's the information, 188 Baptist, or you can also call the American Heart Association. You can visit them at heart.org or the American Red Cross at redcross.org. Gentlemen, thank you so much for being here.
Thank you.